thinking about how you sunset clauses around aid so that our systems won't create dependence or expectations as we move into as well.
Thank you. That's really great. So we're now going to move to Dr. Idogo. So Society for Family Health has developed a model that brings together Nigeria's middle class and underserved communities to help fund health initiatives, making essential medicines more affordable. What challenges and successes have you seen in building this system, and how has it impacted access to healthcare in Nigeria?
Thanks.
If you can speak
Thanks.
to
Can you
this
hear me?
loud.
Yes.
Yes,
Hello?
we can. Yes, we can.
This is comfortable.
Okay, thanks. Thanks for that question. I think the starting point really is to say that the answer to this question flows from your last, which really is the whole financing for healthcare within the continent. And the fact that we need innovative ideas to be able to sort of solve the problem. I think on the, hello?
Yes, we can hear you.
Okay, on the back of even the comment by my last panelist is some sort of realization that even the physical space within many of our countries are actually quite limited, and he did allude to that. So that was the starting point, and actually we set out to solve what we see as four interlinked problems. The one first problem was really a sort of realization that even at per capita expenditure on health, some countries were performing better than the others. And that then meant we had to deep dive what was the problem. And we realized there were fractured sort of supply chain system across the continent. We also realized that because of the paucity of health insurance, except in a few countries, out-of-pocket payment was very high. And so that was the problem. But the opportunity was that we also were in a continent where the middle class to a large extent are very sort of brand aware. So they are very committed to investing in brands, in buying brands. And so what we set out to do was to say, okay, how do we respond to a range of this problem? And the first was to actually put a business to consumer sort of model, using technology to sort of bridge the sort of distance between manufacturers, market authorization holder for commodities, and then send those directly to consumers. But what we realized was that wasn't really shifting much in terms of the numbers and what we needed to do. And so we then moved on to say, okay, maybe we could actually use brands and the idea of brands. And basically, it's a very nuanced system where you actually have both a generic version of medicines, you also have the sort of branded version of medicine, and somehow using a combination of marketing, you are able to actually in some way build a cross-subsidization model that actually make those generics more affordable. And that's really what we've done. We pushed that. We've also tried to test that model in terms of clinical service delivery. And so I'll go on to some of the challenges. The first thing we realized is the model didn't work so well with particularly clinical services, facility level clinical services. But it did very, very well with commodities, particularly for non-communicable disease. So from hypertensive heart diseases to diabetics to some of the cancers. So we're able to actually build a model that delivers a month's supply of meds required for chronic disease management to no more than $1 per patient per month. So which was a very big difference from the sort of the pre-intervention costs that was actually out there. So looking at some of the successes, why this initially was just an iteration to see whether it's possible, one of the big successes was we were able to take this to scale, such that we're talking close to about 2.6 million patient reach in terms of hypertensive coverage, and up to about 1.6 million for diabetic coverage across 6 countries, and we still continue to grow that. We've also managed to improve the quality of medicine because clearly we've managed to control the sort of whole supply chain, and that has improved the quality of medicine very significantly. Because it was built on a hybrid sort of business to consumer model, we've also seen stronger sort of health businesses across the value chain. And that's, we've seen also benefits that now sort of extend beyond some of the initial molecules that we focused on growing. And so overall, it's been very successful in going to scale, which often is one of the many challenges of innovative ideas in the continent. We've sort of reduced costing. And one last word here is that we're actually at the point of saying, how do you now fold this? Because across at least 6 of the countries where we operate, insurance, health insurance to a varying degree is starting to emerge. And that's really where we are at the moment in terms of how we use the possibility of insurance to go to scale. Thank you. Back to you.
Thank you so much. So I think we're going to go through the next round of questions, and then we'll open it up to the audience. So ASG Keita, what are some of the most promising digital health innovations that UNFPA is supporting to expand access to reproductive health services for underserved populations in Africa? What challenges need to be addressed for successful implementation?
Important question. And probably, to go back to the basics. The innovation are there, but we cannot reach what we call at the UN, leave no one behind, the poorest, the most vulnerable one. So, and just like Jonathan said, in Africa today we have 600 million people who have no access to electricity. So, to get there, it's important to have infrastructure built. It's so critical, the health infrastructure first, of course, but electricity needs to be available and accessible. So all our innovation goes through what people like Foster do in trying to reach out for communities to make sure that we get there to give incentive. But we at the United Nations, we work first and foremost with member state countries. We give 40% of our resources to youth-led organizations and women-led organizations for them to go there. But I think good governance is absolutely essential to that. I can give you all the innovative things we do. We have Pride. We just created Equity Alliance that has been launched at the World Health Summit in Bonn, and working very nicely in Kenya, Ghana, and Nigeria. But for me, that's what matters most. We are in a very troubled world today. How to do human development while there's so many crises on the continent, and how to make business as well. We need 226 billion US dollar to make sure that we have a decent sexual health product and commodity everywhere today. How do we get that if you don't involve the private sector? If you don't involve all the digital accessibility? So good governance for me is important. Jonathan said leadership. It's really good governance. I happen to know personally the vice president of Nigeria, having worked in Nigeria with him throughout the Chibok girls. So for me, it's really how Africa leaders going to make sure that we can access, human capital, education, health. Because if you want to do health of education, forget it. It goes together. We are in this university building here. So it's really about leadership, making sure that we can get to the next mile all together. So UNFP will always work with the government, and I think the summit coming on financing for development seems very important. And as I said to all countries, please don't come and ask for more money. Please come and say, how much are you going to put on the table yourself, so that people can match those resources and move along. Because those resources they are getting on the international market are debt for future generations, for you guys. You see what I mean? Yeah. So if me today, I have to, and that my country for you, I was in a government, just like my friend here. If we need to, and that you people, we need to do it very responsibly. We need to do it responsibly. So I really would like here to congratulate those countries who work with us, who have signed compact. Anytime we give them money for commodities, for health, they put their own national money as well. And when they gave us 1 million from their own budget, we put 2 million in it. So that's the kind of model I want for Africa. That's the kind of model I want. Not only sometimes I say when I see delegation at the UN of 70 people coming to a summit, have to stay home to do virtual thing, the digital access, because government have access to digital, contrary to community, so that that money can be spared. And put, maybe Will Foster or Jonathan to make sure that it can be improved on some other thing. I'm saying this because I'm in a university. I don't want to leave you and say everything is perfect. Everything is not. If I'm on the UN try to say everything is perfect, that's everything is not perfect. We need you to have that in mind, to make sure that every time you make a move forward, you ensure you don't go back. You don't go back. And you think the cultural approach for me is so critical. It's so critical. The way as a Mandingo girl I see things, a Yoruba guy will not see the same thing. You see, when a politician tell me, okay, we are going to help women and girls, and then there is no law that forbids the marriage before 18, there is a problem with that. So just to say, things are evolving. We have a middle class in Africa. Digital access is available everywhere that it can be, but we need so much more. The FTTA you mentioned, we need so much more. I want you in the health sector here at the university, those working on commodities, please, please make sure that you qualify your countries so that they can produce those medical products in country. And instead of us paying only within the north, I can have some from Egypt now, I can have some from Indonesia, and I can have some from Kenya or Nigeria. It's very important. That's okay. Thank you.
So Foster, your work with leading the Innovation Village Africa sector, your work with leading the Innovation Village Africa area expands opportunities for startups and entrepreneurs across Africa. How can innovation hubs like these drive advancements in healthcare access and support the development of digital health solutions? What are some of the unique challenges and opportunities that you see for health-focused startups?
Thank you very much. So I think when you look at Africa, there's our curses are also a blessing to us, right? And I say this to mean the challenges presented to us create an opportunity for our young people who seem to lack opportunity in terms of landing a job to create economic value for themselves, to take advantage of those guys. However, they can't do it on their own, hence where the innovation hubs come into the picture. There's a reason why countries are starting to prioritize and double down on how important innovation hubs are to driving or accelerating their economic opportunities. Nigeria is a typical example. Some 10, 15 years ago, technology, information technology, digital services wasn't a priority for the government. Today, it's contributing double digits to GDP. And that alone has quickly shifted government's focus and speed to prioritizing policy, to prioritizing allocating budgets, and also allocating resources to make sure this is happening. There's a much more younger minister today who has been put in place to help drive this even way better, to create more value. Government mostly is incentivized by where money comes from. The more they can generate revenue from a certain place, they start to double down on investment in that area. And today, young people are the gold, new gold or new diamond in Africa. To be able to mine that, you need to create small mines. And these small mines are the innovation hubs, who fine-tune these young people in their minds in terms of infrastructure, in terms of resources, and build the confidence for wherever investment is coming from to double down in Africa. And so I think we play a very significant role in helping solve these challenges. Most importantly, healthcare. Healthcare as an opportunity, as a challenge in Africa, it's not for big pharma, it's not for the guys to come and take over. And that's where solutioning for solving our basic problems becomes very, very critical. Yesterday in Jan's presentation, he talked about how Seychelles had to protect their local entrepreneurial community in the hospitality sector. And some of these protection mechanisms are important for things like healthcare. If you give power to foreigners to own that in your country, then it means control access and economic value goes by repatriated back to where they come from every day. But when you empower young people in the country to be able to take advantage of these things, even at a micro level, the interconnection or the web of micro entrepreneurs is what creates economic value for Africa. And today, over 70% of GDP is contributed by SMEs, right? And so we play a very, very critical role in making sure some of these things can be solved for. And talking to governments every day is what solves that problem. Not entirely, but create some sense of urgency because it's a constant lobbying. Everyone is lobbying for attention. Everyone is lobbying for prioritization. And we are doing that. We are one of the investors in the Startup Act in Uganda. We contribute to making sure government does it, and it's private sector led, right? And until some of these actions are taken, some people, some private institutions take these bold steps to support government to do it. They can't do it on their own. So we play a very critical role, and I believe that's the journey we are taking to unpack and unlock.
Thank you so much. So we're going to move on to Jonathan. So you've worked extensively with multinational pharmaceutical companies to overcome market entry challenges and regulatory issues across Africa. What key strategies have proven most effective in ensuring these partnerships not only benefit the private sector, but also strengthen local healthcare systems?
Yeah, no, thanks for that question. So I would say, and this is going to sound, it's not this easy, but I think like putting people over profit, right, is sort of the thesis for that. Now that's extremely hard to do if, for example, you know, to the point Foster was just making, you're an international pharmaceutical company, and your CEO needs to get on a call with your shareholders every quarter, right? Like that can be difficult to do, but it's not impossible. And I find that some of that, there's a greater sort of awareness within the international business community about the importance of the communities in which they work and the communities that they serve as well, and how those are stakeholders as well. So, you know, without wanting to sound like a broken record, I want to come back to government again, right, and the importance of sort of policy, right, and the role that government can play in not only attracting investment, but also ensuring that, you know, to the point that Foster was just making, those investments comes with technical transfers that build the local ecosystems and the local farmer market where they work. I think one of, thankfully, our African governments are waking up to just how inequitable the global healthcare system is, and I think COVID was a big sort of eye-opener for a lot of African governments. You know, I keep thinking of how surprised some of our presidents were to find out we were like at the bottom of the list for vaccines, right? Or that, you know, it takes about 5 to 7 years for a generic drug that's, you know, approved, for example, in Europe today to actually make its way to the continent. And you're starting to see some of the efforts that are being made to grow sort of domestic production of medicines on the continent. But sort of policy is so critical, right? And ensuring that sort of companies that come into the market are engaging with local communities and are sort of incentivized to sort of fight inequities that exist in the market is really, really key. I think one of the best examples that I've seen lately of this is Pfizer, right? So Pfizer got a lot of flack for their vaccine and how inequitable it is. You know, some people say that during the pandemic, Albert Bourla, who's the CEO of Pfizer, was the most powerful man in the world, right? Because of just the fact that his company could delegate who was getting vaccines. But I think coming out of that, and really kudos to sort of the sustainability team at Pfizer and some of, you know, their African elites, right, on the continent. They've created this thing called the Pfizer Accord, which basically is working to ensure that medicines, especially generics that are sold in Africa, are sold at cost, so not for profit, especially in the lowest sort of income countries. And that gets to the point of sort of noting that, you know, as you build sort of healthy communities, you grow your markets, and, you know, in the long run, Pfizer can actually be more profitable if they invest in building a stronger African economy now, but can also sort of pay back, right, essentially for some of the, maybe not so equitable practices that they've had in the past. And it's interesting to see how that's working. Countries like Ghana have signed on, and it's actually sort of democratizing access to critical drugs. So I think that's really, really important. But without sort of African leaders speaking up and calling out the inequities that they saw, I don't know if we would have the Pfizer Accord, right? So I think finding our voice is important as well. But ultimately, whether you're on the private sector side or in government, or even if you're in the local community, it's all about putting people over profit.
Yeah, thank you so much. Totally agree. So, Dr. Idogo, SFH's fourth party logistics model manages the supply chain for essential items like malaria and mosquito nets by using tracking technology to monitor each item from entry to delivery. This has saved costs and reduced risks. How has this technology-driven approach impacted public health in Nigeria? And what do you see as the next steps for expanding the model?
Thank you very much. I think maybe just talking to where the opportunities lie in the healthcare system, I think it comes from a principle often that is around there are consumers of healthcare and there are non-consumers of healthcare. And often if you look at where a lot of attempt at innovation is often targeted at consumer. But three sort of layers actually underpin where some of the biggest innovations are needed. Supply chain, human resource for health, which is critical, as well as health financing, and what the digital technology can go across these three spaces. So coming to the specific question around supply chain, we historically, as an organization, have been sort of very well known to actually move commodities, vast number of commodities across the terrain of the country, even to the hardest to reach location. But what we've layered on recently is the ability to track every single one of those commodities to the very last point where it's used. And in terms of what that has done, of course, it has allowed for efficiencies in the supply chain. It has reduced theft and leakages. So therefore, from the perspective of building total markets for healthcare, if you're looking at public sector, you're looking at sort of social market sector, you're looking at for the profit sector, we're actually able to isolate commodities and track them across these three different elements of the total market and ensure that the consumer, who ultimately is why we do the work we do, benefits. We've seen lower costs. We've seen better program delivery because clearly you can't have programs without commodities. And I think the ability to ensure that the commodities get there in the quantity that they were meant, as well as the timing, is crucial. And we've been able to use technology to actually deal with this. We've also improved transparency. So it is quite easy to see where commodities go, where the bottlenecks are. And you asked a question around what are we looking at moving forward. We are at the moment layering about an additional 6 data sets to try and build some predictive model using AI in terms of where the bottlenecks in supply chain across Nigeria, particularly which is where we've done this. But it has also helped in optimizing forecasting because being able to actually predict what we get to where and who uses it has helped in a very long way to minimize wastage and therefore better value for money. So in addition, looking forward to ongoing work to improve sort of predictive analysis of what we do. We're also working on expanding to other commodities, so the full spectrum of commodities, including for diseases such as HIV and AIDS, as well as hepatitis, and to scale both public and private channels. So that's what we're doing also. We're also looking at how to apply that technology. We're actually at a piloting stage to track the movement of samples from facilities to laboratories so that we can build more efficient hub and spoke healthcare delivery system rather than trying to replicate the whole sort of gamut of clinical services, laboratory services within one facility. Over and back to you.
Thank you so much. So I think for the next 15 minutes, we're gonna open it up to the audience. So I think we'll have about 6 to 8 short questions, hopefully. So just introduce yourself and quickly give us a question. And please be respectful.
Hi. All right, so Udia is my name. I have two short questions. Regarding issues that endanger healthcare. One, how do you deal with the issue of medical quackery, fake doctors that continue to endanger patient care in Africa, and also the poaching of the healthcare staff by the Western nation? How do you deal
Who are
with
you directing this to?
all of it?
Given the time, it might be best to direct it to you.
Anyway.
Take the
Take a few,
question.
Hi, I'm Fixin. So I'm a journalist practitioner. I'm a frontline worker. I've worked with policies on bringing down the death and mortality rate among like Black and women of color in the U.S. because we also have our own issues. I think my most recent policy that I worked on was on the role of human rights-based approach on pandemic management and how the pandemic was handled. And I think one of the panelists, I believe it was Jonathan, was talking about Pfizer. It came into, like after doing the research and finishing my paper, I just realized that in Africa, we don't have pharmaceutical hubs. I think during the pandemic, it was just South Africa and then one other African country that was able to work and generate their own vaccines to be able to distribute it on the continent. But I think a lot of the issue is that, like, for the Western world, we're a capitalist society, especially in the United States. It's a capitalist society. So a lot of the issues that we were having with Pfizer was that they didn't want to share intellectual property. So what is being done? What are the policies that are being put in place to make sure that should we ever come across an endemic, a pandemic, we would be able to better handle that better than waiting on Pfizer, who is looking for profit? It doesn't help, like, in the long run. And I think my last question is, what is the gateway? What gateway are you creating? Like, what policies are you creating? What gateway are you making for people who are, people like me, who want to give back to Africa? Because I just had a recent issue where a surgeon from Germany who works on heart surgeries was trying to get to Ghana, and he was told to pay bribe to be able to use the OR, to be able to give free services to people who actually need it. So what is being done? I think we'll take like 2 more and then have them answer and have another round.
Hi, I'm Destiny. I'm in the School of Professional Studies. Thank you so much, panelists. I want to acknowledge the quote behind Dr. Udogo, which is that we never lose sight of the women, girls, boys, and men for whom we exist. I absolutely love that, and I think oftentimes women aren't prioritized. You know, our struggles are indeed seen but not changed. And I've been able to work in Southern Africa and observe many of the silent epidemics that mothers, women, and girls often go through. So I just want to hear more about the thoughts on addressing, like, not just the economics, but the social changes needed in healthcare, you know, the cultural barriers that persist in women obtaining better healthcare in the face of our own disparities and conflict and things of that nature.
Thank you. I think one more.
Thank you very much. My name is Kenneth, the CEO of Biometric Tech Solutions in Virginia. I have a question since this is related to health. One of the challenges that we have on our journey trying to incorporate ourselves as an organization organization is data protection laws in the U.S. is very sensitive, and it's crippled most of the businesses because there is a lot of compliance that you have to follow to become an incorporated business. How do we manage this in Africa to make sure we have, and this question is directed to Ms. Keita because she spoke about it earlier, to make sure that upcoming companies are being robust and successful in your journey to make sure that the impact is being made successfully in Africa. How do we manage that?
Thank you. So I think we're going to start this time with Dr. Idogo, followed by Jonathan, Foster, and then ASG.
Thanks, Rikia. Maybe let me start with the question related to, there was a question on the COVID era, the idea of commodity security in Africa. There is actually quite a robust global system, which is known as TRIPS, trade-related intellectual property rights, which does give a fairly good leeway for countries to be able to trigger TRIPS and therefore provide parallel licensing to their pharma industry to then go ahead and basically produce that molecule, which is under contestation or under patent. The challenge is exactly what you alluded to, that at the peak of COVID, we realized that only the Southern African laboratories could actually mass produce those vaccines. However, on the back of that, and post-COVID, I think a lot has changed in the continent. For example, Nigeria has a full sort of loan program that is known as the head value chain, which has seen very extensive investment lately in terms of looking at pharmaceutical APIs and to scale up the ability to manufacture vaccines within the continent. Egypt has also started that in North Africa. So the ambition that the African CDC has set up is that by 2030, we'll at least have up to 6 hubs within Africa to be able to produce vaccine. But that said, what we must all recognize that there are very deep politics around intellectual properties, and even as for public policy experts, even in the context of even the COVID, when African leaders wanted to trigger the TRIPS principle, what we then get was some very, what I see as very rational donations by northern governments, just to sort of forestall they're going ahead to sort of do that. So it's important that while those opportunities are there, some action is ongoing in the continent, but the politics of sort of patents and how they work, it's a whole sort of complex global diplomacy issue in itself. Coming to the question around women, I think you have absolutely right. That's really very much about social norms. The approach that we are taking and the approach to a large extent that many of our countries are taking is that we are slowly evolving from what was a very sort of unifocal approach to one now that is more multifocal, one that recognizes that the problems we're dealing with are very patriarchal. They've actually been entrenched over many years in our systems. And so what it means is that we have to look at the broad determinants of health, from education to livelihood, and then to some of the more practical intervention within health. And so within the health system, there are a number of actions, both in terms of at community level, working through religious institutions, traditional institutions that tends to reinforce these norms, as well as work at more broader policy level, looking at how health financing works. So for example, in Nigeria, on the Basic Healthcare Provision Fund or Vulnerable Group Fund, which is one mechanism to actually put economic decisioning power in the hands of women. Of course, women and girls benefit more from that. Then if you look at the sexual reproductive health space, and my sister in the panel there is even better place to talk about that. We're looking at choices, opening up choices. The idea of client-centered approach or self-care is also gaining traction as a mechanism to respond to social norm. And then I think for healthcare workers, one last point on that is really, that is something that's big, it's important, and at least quite pleased to say that both Ghana and Nigeria now have a clear policy on that. And it's a policy that's looking at how we maximize the idea of migration while also not sort of leaving Africa and sort of not looked after. And part of that is looking at how we increase in-service as well as pre-service. So there The government, for example, in Nigeria, have expanded intake into medical schools as well as schools, ancillary institutions as a mechanism to respond to that. But I'll stop here and back to you.
Thank you so much. So we're going to pass it over to Jonathan.
Great, thank you, and I think Dr. Idogo did a really great job. I don't think I do better than him, like, explaining sort of trips and sort of, the politics behind that. But I think the bigger point is, it's really hard to have these conversations in silos because the politics influences the healthcare, influences the social dynamics, right? They're so multidimensional, and it's really hard to speak. So as much as this is a capitalistic problem, and I think that's sort of the core of it, it's also a political one, right? So he spoke about sort of the pushback and sort of all the vaccine diplomacy that we saw, right? So I remember, was working on this on the Nigerian government side, and the US donated like 250,000 vaccine doses for a country of over 250 million people, right? And so, but it also goes to the fact, that there's interests in the healthcare sort of industry that need to be protected. And if you think about the fact that, the people who give, or the industry that gives the most to sort of Congress, right, because of Citizens United, is really essentially the healthcare. It's just so interconnected. And so as we're sort of dismantling the capitalistic issues that are at play, it's also important to think of the political, the social, right, because it's so multidimensional and it's hard. But I would say, one of the things, thankfully though, because of leadership, for example, Ngozi Okonjo-Iweala at the World Trade Organization, at least this is a conversation that's happening now, right? And that's also the importance of having, people who look like us in positions of global power, right? So people like NOI, people like Amina Mohammed, ASG at the UN, right? So, so that's really important. And then the other piece, maybe I'll speak a bit to the healthcare worker issue as well. And again, I think it's sort of multidimensional. So I actually think what's causing some of that healthcare worker or brain drain is not necessarily the healthcare system, it's more a macroeconomic issue, right? And it's sort of migration for economic issues. And I think if African healthcare systems were better, yes, but more importantly, if African economies were a place where, African healthcare workers could thrive, I don't think we would have that much migration. I recently saw a statistic that sort of hit home for me because, in all of Nigeria, there's 30,000 doctors, right? But on the UK General Medical Register, there's over 15,000 doctors of Nigerian descent, right? And over 8,000 of them have migrated in the past 4 years, right? So it's really, it's a big issue, but I think it's hard to say, the way to fix the healthcare challenge is for Nigeria to become a better economy, but I think that's actually a major factor. And what, the push factor there is economic opportunity and not necessarily the healthcare system.
Oh, the experts have spoken. I think maybe I'll tackle the data-related issue. Data has become the new gold. It's a cliche. And in the system of healthcare, even more sensitive, but also very opportunistic. Some of the challenges we faced as a result of COVID was starting to figure out how better we can design protocols to allow sharing of those information, to facilitate study, to facilitate patterns, and to be able to design better and faster solutions to address some of these problems, to avoid pandemics, endemics, etc. And I think the challenge remains, have we gotten to a point where we have built stronger protocols that can facilitate exchange without losing the ethical nature of the use of the data, right? In Africa, this is a very, very gray area. Countries are still defining what its data sovereignty, data governance, data sharing means. And in healthcare, which is probably the longest in terms of data protection, in terms of its use, the use of policies around data protection, it still remains the use of technology and all of that, people migrating into those healthcare information services, is starting to we are starting to see emergence of the gaps in data management practices in healthcare. And that presents an opportunity. The late Dr. Miles Morales is where there are problems to their businesses. And for me, I think it presents an opportunity for most of you here who are trying to venture into healthcare, not just in the ER, not just in the labs, not just the business and administration of public healthcare. It's a very huge one. And Africa being in the gray presents an opportunity for us to learn from the West and do better. Do better means what could they have done better with the protocols they have designed here? And how do we leverage those gaps to create a better system for Africa and in Africa? So leapfrogging for us, I always say, is the biggest opportunity we have ever had as Africa. And for all of you here who are learning today from the West, experiencing the systems here, you ask yourself, how better can Africa's system be? And that's a call to action I'll leave to you guys as we probably go off the conversation. To challenge you, come back home, but come back with better solutions. Don't join the cliche. Don't come and blame the government. Really, if you're a medical doctor and you're not being employed as a medical doctor, how else and how better can you use your skills to solve other problems related to healthcare in Africa as an entrepreneur?
Fantastic. As Dr. said, science has spoken from all over the place. Let me start right where he handed about the data protection. I think he said it very, very well. And what we do as a UN, as a global, and all agencies, UN is big, all over the place. Imagine, all agencies, from the UN. I'm just back from our meeting on program in Madrid on the ethics of artificial intelligence, on data protection, etc. That committee is led by UNESCO because of science, culture, blah, blah, blah. You see, it's that's where you see how much the multilateralism is important. I have attended a meeting that all of you would love to attend. My boss was not available, so she sent me. It was with all the boss existing on this planet, with the Secretary General, all the principal, to discuss exactly that. Imagine you're sitting in the room, the best economy, the best scientists. So we're really working to ensure that, we help Africa and the rest of the world to get there. And we are working. It's a work in progress, but we are getting there. Now, healthcare personnel is so important. We are 8 billion of us on this planet. 8 billion. We have 1.9 billion of young people. 60% of those are from Africa. And it's either we have two choices. Whether people come to Africa and work there, and the continent will try, or they will all go out. And then we are in trouble, and they will need to change all the migration laws. So this is the reality that is happening for Africa today. Either everybody goes there because the market is there, we can do the job there, or everybody goes out. Today the politics will have to make a choice of that. So I like what you said, was if you want to come back, but use both words properly. Don't rush for the sake of rushing. Use it properly, because I think it's important. And remaining on that part, the Afro-descendant part. Since, as I said, I'm global, I work on all the issues, it's so important. Let me take the part where you want to give. You can give at every level possible if you want. I was 10 days ago celebrating the life of Dikembe Mutombo in Atlanta. Why? Because the work I've done with him in DRC, the hospital he built, thanks to his MBA money, has saved so many lives. Cervical cancer, we have screened more than 10,000. Fistula, obstetric repair, etc., etc. And we use expert doctors to make sure that that is happening. You can give, or individual giving. Go online, you can go to UNICEF, UNFP, you can do. There is always a way to contribute, to give in any way you want to do it. For me, women and adolescents are priority for a mandate like mine, like UNICEF, because of the social norm. Something I said, if you don't change the law, even for marriage only, what are you going to do? So every sector is critical to make health sector better. Every sector is critical to make health sector better. Jean-Paul and I are in this room. I am from an LDC, least developed country. He's from the high level income country.
The richest.
You know. But would that benefit from the poorest in our both countries? That's the real question, actually. Same thing for the US, the furthest behind. You see, where are they? Those are the ones we need to find wherever we go. Whatever you do, us being here means we're all privileged already. Yeah. All of us. Despite all the trouble we go through, and we all know that we go through troubles because we need so much more, so differently. So you, as the young generation, let me tell you, you are on power already. If you don't take your chance to do now and wait for tomorrow, it will be too late. For me, I truly believe, I mentioned my 30-year UN. I left the UN to go work as a minister back home because I had to. I was bored in what I was doing. And believe me, I have a lot of respect for government as well. Sometimes you want to do the best you can, and the system blocks you. Yeah. Because they are the corrupted one, there are other things happening around. I said, okay, my friend, I'm going back to work, try to manage that. I'm going to die here. And then you go back again. You see what I mean? There is no right or wrong when you are sitting in this room. What it is to try your best. To try your best at every single time. And please, as I said at the beginning, I came today here because a young lady asked me. Not because it was Columbia, not because I said if she can ask me, whatever I do is more important to show for her, to showcase that she can reach the limit if she wants to. So that's the message I want to leave you, all of you. We are all unique in our 8 billion. We all have infinite possibilities. So use them wisely, crazily, the way you want, but use them.
We can have like 5 or 4 more questions.
Now we have to conclude again.
Hi, my name is Juliana. I'm a second-year MBA student at NYU. I guess my question is, what role does mental health play in the advancement of healthcare in Africa?
Okay, we'll take a few.
Hi everyone, my name is Krista and I'm from Rwanda and I work in public health.
Closer to the mic.
Sorry. Okay. So I was saying I'm from Rwanda and we recently had a Marburg virus outbreak. And my question is for Madame ASG. So in Rwanda, when we had the virus outbreak, it was significant, but the local health organizations really did all that they could to help manage and help react in a way that's been lauded and appreciated by the WHO, African Union, and things like that. But despite all of that, we still got a level 3 sanction from the CDC, which was a warning, but is essentially a sanction because it discouraged people from traveling to Rwanda. And for us, our economy really does depend on travel and tourism. And so my question is, how can the global environment start to recognize local health approaches to this new work? Okay, sorry, can you hear me now?
Yeah.
Okay. So essentially my question was, how can African health management efforts be better recognized and supported on a global scale so as to prevent sanctions that harm our economies?
Hello?
Yes, we can.
I will not come with a question, but more of a provocation for reflection. And I will start by fully agreeing with my colleague Jen. The provocation I'm going to make is that I'm not a fan of budget-related tariffs. And the reason is I've been both Minister of Finance and Minister of Health. And in that order, I was Finance first. And the problem with that is that when you become a Minister of Finance in any country, there's not suddenly a pot of money that you divide. The first thing you are told is there's no money. And the first thing you learn as a finance minister is to tell others there's no money. And then the key issue is prioritization. And so the thing about health financing is what you prioritize that then allows further things to happen. And the problem with budget-related targets is that we set ourselves up to fail. Because we already have a finance problem in Africa, a resource mobilization problem, and we set targets that are not going to be reached immediately. I much prefer focusing on targets that are related to development goals, and as Janet said, what are the things that are achievable that make the most impact, and from a cost-effective perspective that require the least initial upfront cost, and that is things like maternal health. Have a target of no maternal deaths, and what that means is you need to look at the basics of where do women have access to health? Is it within reach? Secondly, do you have trained professionals to work with them? And do they have access to appropriate medication? And these are things that actually, when you break it down, this is something that African governments can do themselves, right? And parts of it as well can be done by working with people who are already based in the community, and with empowering entrepreneurs that are involved in those sectors, designing solutions that are fit for purpose within the community. So my provocation is, when we think of health financing, of course, and I'm not going to say it's not a bad thing to have a target that is a percentage of a budget, but to put it in perspective, Seychelles has the highest, I'm from Seychelles, for those who didn't know. We have the highest in Africa percentage of budget. It was about 25% when I was minister. But as a percentage of GDP, Seychelles is not even in the top 20. What that means is that the financing in health is coming mostly from government, right? Which means that other people can focus on other things. And it's also the efficiency of health spending and the prioritization. And when you start, if you look at things like children's health, maternal health, these are the building blocks that actually cost less but have higher impact across the economy. And I prefer focus on those targets. So that's my provocation.
Hi everybody, my name is Nakasi Zawa. I'm with Burkina Faso. So I have a question for Chiquita. And you mentioned that in regions affected by conflict, like my own country, UNFPA faces challenges in reaching communities, amongst other things. But can you talk specifically about goals or even strategies that UNFPA has done to ensure essential access to health for high-risk zones or conflict-torn countries across Africa?
Can you hear me? Hello?
Yes, yes, we can.
Hey, I'm Jonas, studying cardiology at MIT. My question is, so in all of your initiatives for healthcare, how do you measure success? And also, who sets those metrics of success?
Okay. I think one more. Unless we can have two quick ones. Thank you.
Hi, my name is Tone. I'm a women's health nurse practitioner and I work remotely. My question is, so I do see an opportunity for healthcare professionals here to consult with healthcare professionals in different African countries as well as educators, even though millions of people don't have that sort of access that, people have here where they can get remote health care. They can be key leaders in the community. So for those of us who maybe can't quite pick up and leave right away, that's an opportunity. And so I wonder if there are enough organizations or if there is any talk about this kind of opportunity with access. Yeah, that's my question.
Thank you. And one more.
My question is regarding, so we talked about innovation policies, commitments, and reach, but I'm interested in what's being done for the often forgotten populations, those with disabilities, both developmental and acquired.
Thank you. I think you can answer which question you would like. And once again, we will start with Dr. Idogo, followed by Jonathan, Foster, and ASG.
Okay. How do I share it?
Thanks, Ricky. I think maybe just starting on the second to the last question, the question around what metrics do we use to measure success, and relate that to the comment made by the Honorable Minister. I think that's a bit of a very, I would say, topical conversation going on at the moment. The discussion between whether we pay for imputes, which is the metrics that are looking at, for example, 15% of national budget. That's a very impute type metrics, or one that looks at paying for outcomes, which was some of the comments that is made. So outcomes like, if you can reduce maternal mortality by X%, you get. The challenge is that the global sort of architecture for development response is still struggling on accepting that pay for outcomes as distinct from pay for inputs, which has been the norm for many years. But I think that's a conversation that will continue for some time to come. But it's something that I fully agree with. And for us in SF, it is something that we've done very well to say, look, we are willing to take risks because we believe in the approaches we've adopted. So we are willing to take on even a pay for results type arrangements. And we do that with some of our country governments. So coming to some of the more measurement of metrics that we use, of course, there are sort of standard measures. We all know those, reducing maternal mortality, reducing under 5 mortality, looking at out-of-pocket payments and how we work on those, looking at satisfaction with the healthcare experience and all that. So those are what we see as very distal or impact level indicators almost. But you have sort of more proxima indicators, of course, that depending on the programs you design, you track. So for example, on the two that I spoke to, if you're looking at supply chain, so supply chain have very specific metrics for actually tracking, and it's really about the availability of commodities at last mile, metrics related to stock out of tracer commodities at facilities, looking at the quality of commodities that are delivered, and therefore the integrity of the supply chain. So those are clear metrics we use. If you are looking at one related to bridging the middle class, and again, that's very financial type data we look at. So you're looking at whether out-of-pocket payments are reducing. You are looking at patient reach, which is one of the points we raised about that. Even pharma are starting to look at the idea of patient reach as very distinct from even profit, and trying to get a balance between profit and the patients you're actually serving. So those are some of the metrics you could actually look at there. And finally, on mental health, just to say, many programs are actually mainstreaming mental health. Thankfully, that's becoming something that incrementally within the continent, we are starting to recognize, and both at policy as well as programmatic frontline, a number of those are emerging. But are we where we are supposed to be? Not at all. I can tell you, for example, Nigeria as a country, we are just revising our mental health law, which is how many years old, so it's a lot to do. My final pitch here before I close is to say it's been a real experience, opportunity to talk to all of you, and there are really lots of spaces, opportunity to give back to the continent. Smart ideas are being looked at, like I say, startups that respond to how we domesticate health financing, startups that look at, like one of the contributors mentioned, that improve ability to connect doctors here, healthcare workers here with healthcare workers in the north. Those will be great in terms of advancing our shared interests. Thank you, and back to you, Rakia.
Thank you very much. We appreciate that. Jonathan?
Great. Yeah, no, thanks. Pretty quickly, maybe I just want to, sort of agree with what, I don't know if they still call you Honorable Minister, but
that's all.
The Nigerian elite can't not call you Honorable. Yeah, so I want to agree with what JP said, because I think he's very spot on, right? So especially given what's happened since COVID and the fiscally constrained sort of environment that governments are in, we need to sort of stop thinking about necessarily inputs, but also the best buys, right, for financing. So for example, I think as Rakia mentioned, currently do some work supporting the government of Nigeria with their work. And for example, we're at the end of October. But so far, the government has only spent 35% of its budget, right? That's all that's been released from the Ministry of Finance, right? And so if you think about that, you really need to be efficient with your spending, right? And think about what will have sort of domino effects down the line. And I think there's research, and it's very clear that that's maternal and child health, right? So investing in things like nutrition, right? That, you know, if a child gets the right nutrition, they're 16 times more likely to be, they're going to be 16 times more productive, right, in the economy. Or, you know, if you invest in little things, like, you know, for example, very cheap innovations, right, like maternal azithromycin, or IV iron. Those are things that really, you know, extend, you know, the possibility of taking down maternal health. And we know that if a woman, if a mother survives, her child is 37% more likely to also survive past their first birthday. So I think thinking of those bed spies is some of the work that the government of Nigeria is doing now. I think goes to the point that, you know, JP made very clearly, thinking about not just healthcare spending, but how are you making health a bigger part of your economy, and improving productivity. And then since we're closing, I think there's probably many people in the room who are African or of African descent or have really strong ties to the continent and are very interested in going back. And I think the clear message from the panel here has been, yes, absolutely go back, and I think we'd all agree. I would just add on top of that, though, that it's really important to return and approach the continent with humility, right? So not knowing what you don't know, and being open to learn. I think for many of us, especially those of us who, I say us, I didn't go to an Ivy League, but many those of you who might have an Ivy League education, have rubbed sort of, and I see this daily in my work, you know, you think you may be smarter than, you know, like your African counterparts or the people you will engage with. And Africa will humble you very, very and this is from some personal experience as well. So I think just that humility is really, really important. And if you don't wanna be a statistic of the people who went and then quickly came back, right? I think just like having a learning posture is really, really important.
I already concluded. But yeah, I just to wrap up and piggybacking off his last words, Africa is very unique, and doesn't necessarily pertain to healthcare. It's an Africa conference. It is youth. I've had the privilege of spending time in about 40 African countries already, and every single one of them teaches me something. And yesterday I was having a very interesting debate with Jean, and there's so many things and so many opportunities available for you, right? If you can, and like she said, every one of you is privileged. It's expensive to travel in Africa, but you need to first experience it before you make a decision of what you want to do in Africa. And I play a role of expansion. So my job is to consistently, in the management meetings, remind us that we don't have a single and all-size-fits solution for everyone. So customization, localization, spending time in the markets, all of that. And you can use your vacations now. Just go. Don't just be a tourist. Engage the guys, the transport service guys, the tourists, the market women. Like, just get to understand the microeconomics before you get into the bigger rooms. Because the reason why Africa is what it is most of us who end up coming back home and getting into these C-suite rooms lose sight of reality. And losing sight of reality doesn't give you local context to the impact of your decisions. The agency required to prioritize and deprioritize what is more important to the local person in the country. It's very, very important in how you solution what you solution for and how affordable and accessible that can also be. So let's humble ourselves and get closer to reality. The reality is not in these rooms. Reality means parking your car and walking down the streets. And that is what I'm going to do with guys.
Please allow me to go very quickly to one question you have not answered, I think, on the last panel, was about what if another pandemic were to come very, very quickly. Look, we are, just take Sierra Leone, Liberia, and Guinea because of the Ebola. When Ebola came, there were so many things out of it. I think they got less touched by the pandemic because of that. They were ready. They were ready. So just to say that Africa is taking less learning from what is happening, and different level of center, I'm not a specialist on the domain, are being created in different countries to make sure that we can face those pandemics, just like what happened into Rwanda. I just wanted to go back to that because I think it's important. You know, mental health, I like the issue of mental health. You need to note first if you have a mental health, it was not even an issue before. It's very often it's very new for most of Africans to say, okay, I may have a mental health issue. So there is again an education, a capacity building into that. I remember my boss, who is an Afro-American woman, telling me that's exactly what you mean. That's microaggression. I don't know what a microaggression was. I know it hurts, but I don't know why it hurts. And she explained it to me very nicely. So the same thing for mental health in Africa. There's so many things we need to there. In Africa, men don't cry. They're not supposed to, at least. Right? Only women, and they don't realize women don't cry in Africa, really. Even if they give birth in the most difficult conditions. So there are those preconceived notions that need to evolve in Africa as well. I think I wanted to mention that because that's very, very important. JP, I like what you said, and from a former minister to another former minister, my job was international cooperation. Go and find money to bring it in. But when you bring it in, and I got a lot of those, make sure that they're well used, well spent. That's a nightmare. You give to you don't want to be corrupt. You don't want your reputation out of line. So it's not. I think the money is not enough. How you do with it, it's important. Now, UNFPA, I love what he said. My 3 strategic objectives are the following. First, ending all preventable maternal death. That's my first one. The second one, meeting all unmet need in family planning. And the second one is ending all gender-based violence and harmful practices, which is worse than even the GBV by itself. So, and that's what he said is very, very important. Start with what you can start, because we can all do that. We can all do that, everybody can understand that. And I think that's very, very important. Now, for disability, it's so critical. We matter. Myself, we matter, we belong, we decide. You know, disabled people are so different. I know people who are lawyers, who are engineers, and they don't see anything, they don't have, but they're so good at what they do. Now, I think more and more in Africa and other places, we make them abuse because they're so useful. They're so scientists, that's probably better than all of us, that we realize that we are missing some part of the most important population and the one we should be working on. Rwanda, again, the outbreak, as a scientist myself, honestly, if there's an outbreak, they should ban everything. You see, it's tough. We all went through the pandemic, but that's why we're working to have those levels centered to make sure that, you know, it doesn't happen, or if it happens, it's controlled. You know, Africa needs to rise up to that level. If we want to be compared to everyone in this planet, we need to rise to the challenge. Now, there's something I love at the UN very much, the behavioral science, what we call UN 2.0. You know, I attended one of those sessions. The UN in 50 years, I had an exercise, 2 hours. I took my time, I really had fun. But now, University of California, Davis, I think it was, and one university in India, those scholars fighting to each other. It was such an eye-opening for me because of the cultural part. When the guy from Davis, said, India, said, please, my friend, don't go that way. If you want to work in pain, you have to think ABC. So that's why what they say about the cultural approach, what they say, you know, even talking to each other, for us, it can be different. You know, I like the Nigerian, the current VP president very much so. I've seen him work. I've seen him on the ground. I believe in that kind of person. I'm sure JP will go back in his country one of these days. To become head of state.
Not that bad.
You see what I mean? He will do. Me, I don't know yet. Because not the same kind of country. I need governance to change seriously. Otherwise, I'll not do that. It will be waste of my talent and waste of so many other things. You see what I mean? So just to finish up on say, what we have here, your best, biggest asset is networking among yourselves. It's having all our contacts, making sure that you can reach out to any of us, wherever you are. Look, hello, help. I'm lost in Accra. What do I do? Is it the jollof rice is Ghanaian, Nigerian, or But, you know, so debate for lunch. But just to finish up on what the Burkina lady asked me about conflict, about those, we go there, that's our job. Our Secretary General says stay and deliver from Afghanistan, and we're everywhere. When Afghan was killing women, we had to get our colleagues out of the country, literally. And at that time, men were the only asset we had to protect the women present and the children. Don't forget that. That's why the gender equality has some components that are very important. Only men could go out with the women and the kids to protect them. So when we say right and choices, when we say gender equality, as I said very often, for the political department, and those people are in there, even the GP, they are political department, secretariat people, the coffee people, as I call them. Those people, gender means women. But for us, gender means women, men, LGBTQI+. These are everyone that exists, does not exist yet. So that's the problem within the UN ourselves. Some of us, we are the humanitarian, we are the operational harm. We don't care, I say everything. Some when the government tell me, oh, what you say, it doesn't exist. Say, look, I hope in this room as well, that I said to the board, I hope, the only thing I know, we are all born one day, isn't it? I hope it was out of gender-based violence and from love, right?
You didn't get that.
Some were not happy. Some were not happy. But that's what you need to think yourself every single day. There are some babies, there are some adults, they were born out of gender-based violence, out of harmful practices. And that is what inequality is about. That's what poverty, whether it's intellectual, it's physical, it's human, is about. So having this opportunity again, I'm so grateful to you, Rector, for offering me that chance to have this things here. Let's give a round of applause for our wonderful panel.
And thank you all for joining us. So I think we'll take one picture. Doctor, thank you. Well, we'll take a picture with everyone. I think that's what they do.
Here.
And then we'll head to lunch. Thank you.
Thank you to our